Hi, my name is Dr. Simon Agger, chiropractor and clinical nutritionist, and we're talking about foot pain. We're talking about some of the named entities that we see commonly in the clinic. Plantar fasciitis, a lot of people are familiar with. This involves the plantar fascia, which is a fascial lining which goes from the heel bone all the way to the ball of the foot. And one of the things you have to understand is that when we are using our feet and we're running, or we're doing a lot of walking, or we're increasing our mileage, or if we've got excessive levels of inflammation in the rest of our body, maybe poor blood sugar control, maybe poor cortisol control, maybe a named disease or an autoimmune disease, we're going to have more inflammation in the body. And the foot is no different than anywhere else at reflecting levels of inflammation. You may have, very commonly we'll see people with mild levels of bursitis in the shoulder. They also have mild level of plantar fasciitis. So what's going on down here? One of the things that happens in the feet is that you have a natural arch. If this is the heel and this is the toes, that arch will fall to a certain extent when you put weight on it. And if that arch falls too much, you can see what happens between the ball and the heel. They increase like that. And one of the things that happens with this is you get to a situation where this plantar fascia gets stretched. And a good way to visualize this is to visualize a right heel from the back, where this is the heel bone, there's the back of the shin bone, and that's a neutral position. When the arch falls, it makes the heel roll in. When the heel rolls in, we call that pronation. When it rolls in significantly, we call it overpronation. And what happens with overpronation is that arch lengthens, stretches this guy, and we get a lot of pull and irritation right here at the base of the heel. And we start getting heel pain. Always worse in the morning, always worse with activity. So one of the first things we need to do if we've got foot pain is get an exam, so we can figure out, okay, is it one of these common foot things, or is it something else? Then we can establish a diagnosis and a treatment plan. So for plantar fasciitis, one of the first things we're going to do is we're going to support this arch. We're going to take a weight-bearing scan, make some custom orthotics, or we're going to get a generic arch support, which will take 70% of this fall out, and it will take a lot of stress off this area. Huge. So one of the things with dealing with any foot pain, whether it's in the heel or whether it's in the metatarsal area, which is the metatarsalgia, which just means irritation of the metatarsals and pain through here, is we're going to look at support, and we're going to try and correct the pronated foot with some support. It takes a lot of pressure off these areas. The other thing we're going to do is we're going to ice. For plantar fasciitis, you're going to ice first thing in the morning because it's going to be the most painful. If you can get your foot on some ice for 10, 15, 20 minutes, cold, burny, achy, numb, 20 minutes in the morning, you'll notice a massive amount of relief. As the pain comes down, how does the pain come down? Well, sometimes this joint is restricted. This is the heel joint. It has two articulations. That means it's up against a couple of other joints. The talus, right here, the subtalar joint, very common to find joint restrictions on this, especially if there's been a chronic pronation or flat feet going on for a long time. And the other one is the navicular, which is very close to that. And both of those we can adjust. As you know, because you're chiropractic patients, you know that a prerequisite for good motion is joint motion. So if we've got a restriction here or here, and it hasn't been checked or it's been missed, and we've got an arch support and we're doing everything, but we're still getting heel pain or plantar fasciitis or metatarsalgia, maybe we need an adjustment. So make sure we get that examined if you've got some foot pain. Also, anti-inflammatories can help, both non-steroidal anti-inflammatories and natural anti-inflammatories. But first, let's get it some support. Let's get it adjusted. Let's get it some exercises. What exercises are going to help take stress off this? Stretching the plantar fascia. Now, if it's too acute, it's not going to work, and we're going to have to put you in a boot for a while. But more commonly, we see the low grade to mid grade plantar fasciitis where We can get therapy on this, we can get ultrasound on it, we can adjust it, we can ice it, we can tape it. Athletic taping can take a lot of stress off this, and it's not expensive. And once we're moving through that, getting you out of the acute phase, then you can start stretching it. And not just stretching the plantar fascia, but also stretching the Achilles too. And that works very well in chronic plantar fasciitis. Handle any other systemic inflammation, and you do a lot better. Plantar fasciitis, incidentally, is also known as policeman's foot in the UK, for UK viewers. Now we're going to talk a little bit more about heel pain. So if you've got heel pain and it's not plantar fasciitis, what could it be? Well, there's two common things that we see. One is bursitis in the back of the calcaneal through here. Another one is bursitis right through here on the heel pad. Bursitis just means it's a swelling of the bursa, usually because there's some abnormal pull on the tendon. Very oftentimes there's tightness in the plantar fascia, there's an overpronation problem, or there's chronically tight Achilles, and we start getting bursitis through here. So we're going to be icing, we're going to be resting, we're going to do some massage therapy through these areas, we're going to be adjusting as needed and rehabbing with the appropriate lengthening and strengthening exercises so we can improve the biomechanics from this to this. Metatarsalgia, we talked about. Inflammation of the metatarsals. Sometimes there can be a toe that's a little longer than other toes, and that can mean that one metatarsal gets a little more stress than others, and we can use some metatarsal pads in the shoes, and we can also look at pronation and working with massage and other supports to take that down. Also realize that there's areas that can be joints in through here. There's 5 metatarsals through there. They can get restricted. We can get adhesions between those. Mobilizing and adjusting can make a lot of difference there too. We've just talked about heel pad syndrome. Bunions are what happens when we get repeated pronation. And what happens is that the big toe starts to go across this way, goes valgus. And as a result, we get a lot of torque on that first joint in the foot, and it starts creating a extra bone there. So if you've got a bunion, then arch supports are mandatory. And we also need to see, is there overall inflammation in the body that needs to come down? Are you in a pro-inflammatory state, which is contributing to getting extra pain in the feet? Finally, gout is a metabolic disorder when we have too much acidity in the body, we have too much inflammation in the body, and we've got problems getting rid of some of our waste products, namely purine, crystals, but we get a lot of crystal deposits in our joints, and that's just because we're out of balance. And the appropriate diet, nutrition will take care of gout. Some medications like allopurinol can be helpful, and that's a longer metabolic type nutrition, diet, lifestyle treatment, but that will take down foot pain. And now gout, mostly you see that in the toes or the feet because they're a long way from the extremities. You'll feel them there first. You can also notice it in the hands though. So gout's an important one. And aside from local strains and sprains that we see, ankle, I didn't put ankle sprains on there because pretty much everybody knows how to manage those. But I get questions about some of these on a more regular basis. The fact is, be aware of whether you're pronating or not. If you're in neutral, we do gait analysis every day in the office. We also will weight bear screening from taking a photo with your weight bearing, and we'll be able to check your joints and examine you and assess for any of these conditions through here. So I hope that helps your understanding of foot pain. One last thing I want to say is sometimes you can get referred foot pain coming from the low back, and that's a sciatic type situation. I refer you to our talk on disc injuries, low back pain, or lower cross syndrome. We all talk about referred pain going from the low back or the hip into the foot, and that's another potential cause of foot pain. But that pretty much covers everything. And if you have any questions, feel free to get in contact with us and call us. Again, my name is Dr. Simon Agger, chiropractor, clinical nutritionist, and thanks for listening.